Good morning, good afternoon, and good evening, and welcome to the Therapy Matters podcast, your one-stop resource for expert insights and advice on everything therapy and rehab. I'm your host, Allison Jones, and today I'm joined by Matt Huey, owner of Strong and Healthy Rehab. Matt, thank you for joining me today.
Thank you for having me.
It's great to have you here. So, Matt, before we dive into today's topic, I want to give our audience background on who you are. So take a minute to introduce yourself and tell us about your experience in your clinic.
Well, my name is Matt Huey. I've been a physical therapist 13 years now. Been in outpatient orthopedics the entire time. I am a diplomat in MDT, meaning the McKenzie approach, if anyone is familiar with that. I'm also a fellow of the American Academy of Orthopedic Manual Physical Therapists. That long acronym on there. Everyone says I got the alphabet soup after my name. And along with that, I am a certified manual trigger point therapist as well. And I've had my clinic roughly 3 years now. Started it in 2001, early 2021. And just it's been growing ever since I started up, and it's been a very, very fun experience as well.
Excellent. All right. So today's episode, we're going to focus on the patient journey and patient experience. And this topic, it really fascinates me from a personal and a professional point of view. So I'm a marketer by profession, and I've been, in marketing for all of my career. So anytime we're considering building a business or you're driving growth, the customer experience is always, an integral part of that customer journey. So it's always part of that, a key part of that story. But I'm also a patient, and I've had the pleasure and the pain of interacting with clinicians and therapists throughout my life. And, whenever I go in for an appointment, I always pay really close attention to how I'm treated, probably because, I'm a marketer, but I think in general, most patients pay attention to how they, interact with the front office, with their clinician and throughout the experience. So I'm excited to dive in and talk to you about your approach and how it's helped your patients thrive, because I think you have a really interesting story. So when we did prep for this episode, you used the phrase walking with your patient to describe your approach to patient care. So tell me a little bit more about what does that mean to you?
So for me, I see myself as a guide with a patient that really we're going to go from A to B. So the patient comes in, we're dealing with all this pain or limitation or something like that, and they have this goal that they want to reach. And really just being that person that helps them along that journey. And so it's just not only like the stuff we may do one-on-one, but also being a resource when they start going back to their life. Of saying like, well, can I go back to the gym? Can I go to work? Can I take that trip I have in a couple of months? And just giving them kind of a outline, a guideline to say, hey, play within these bounds while you're going about your life right now. And as they reach that end point, they're very confident. They cross it. They're like, hey, I feel really good. And for me, I just see it's like I'm just end up just being a resource for them about really anything that may be going on with not only the condition that they're dealing with, but maybe they find other stuff out there. Somebody tells them, I have this back pain and, I'm getting better, but a friend of mine, they told me I need to do this, or I got to go see this person. What is that about? And I get a chance to talk to them as well to say like, oh, that could help you, or, really, no, we don't really want to do that, or this is what this is. So just being a resource for them as well.
So it's really beyond sort of the traditional patient-provider relationship. It's almost a like you're creating a relationship with them. So I don't want to say it's almost like a friendship where they feel like they can come to you with almost any sort of question or concern beyond even just their care.
That's really what it is. I always said you think about, if somebody came up to me and it's like, oh, I need to get my hair done. Where am I going to go? And they say, oh, go to my hairdresser. Or like, oh, I need to get my teeth cleaned. My tooth hurts. Where do I go? Go to my dentist. And so I tell people, I want to be your therapist on that so that they feel that they have a phone number or a contact in their phone. If I have some health question, I can go to this person. I can send them a text message. I can call them. I could email them, and they're gonna be there for me.
So one of the other things that we talked about, so we talked about larger PT providers. They typically are scheduling multiple sessions per week, and they're prescribing an exercise regime that might take an hour a day or longer. How does your approach differ from that?
Well, I really look at what the person needs and what they are going back to doing. And it's nothing bad about, I always say, nothing bad about anyone who may work for a larger corporation or there's great therapists there. They do amazing things. They help so many people. But I just saw for me, I was conflicted with some patients because it's like your condition really, you don't need to come in twice a week or 3 times a week. You don't really need that. I have enough confidence in what you can do on your own. You're already a very active person. You probably can do way more than what I could do in this clinic. And it's kind of based upon some limitations as well that we can have as therapists. So like with insurance. So insurance may limit the number of visits with a patient. They're saying you can only see them 30 times in a year. Well, do they need to come in 3 times a week now? Because we want to have more later. So, okay, we could work around that. Or again, this person is very active or something and they go into the gym. I don't have that same, equipment here just because of limitations in the facility, things like that. So I can't have it here. So I was seeing this like, hey, if we just open our communication, we talk, I see you for something. I want you to get back to your function. I want you to go back and do those things and just talk to me while you're doing them. So they are being functional, getting back to doing what they want to do. And they're understanding, if I start having this, I know how to do that to help it or whatnot. And I have a very interesting case. A patient I just saw not too long ago. Wife, mother, probably late 30s or so, had knee surgery, and she contacted me saying, hey, you do a rehab? Sure, perfect. I'll see you. And over like 3-4 weeks, she was doing really, really good. She was up walking with no assisted device. She could get up and down off of low surfaces. She was able to drive. She was able to go out with her family. I mean, still some limitations. Like stairs was still, she felt a little shaky on stairs, but overall very, very good. She saw her surgeon and he said, oh, you need intensive physical therapy. And I was like, what the heck is intensive? Like, is that a clinic to go to? Like, what? And she goes, I don't really understand that either. And I said, well, what did he say? He goes, well, he wanted me to be able to do like jumping and cutting and running. And I said, do you do that in the first place? She goes, no. I said, do you even go to the gym? She goes, no, I walk around the neighborhood and I have a treadmill and elliptical upstairs. I use those. And she's like, I said, well, why? We don't really need to do running and jumping and cutting, and do we need to do these really crazy dynamic things for you in another couple months to stop doing them and never do them again? So I said, we're going to get you back. Now, if you want to start going to the gym, we could build you up, we can get you to that point. But really just going back to her normal thing, she wasn't going to do that in the first place. But we got to where she was very stable with long walking and telling her, go to the mall, go take your kids and family to the mall. Like, you walking around for 3 hours can do a whole lot compared to what you can just do in just a little bit of time with me. And also, you probably don't want to sit and look at me while you walk for 4 hours. But as I said, just live your life, do what you can do, and we'll just kind of work within that. And, so overall, like it as well, it saves me a lot of cost. I don't have to buy a lot of equipment. I don't have to have a huge facility. It saves a lot of time on the patient. Patients are like, well, I'm not taking hours out of my day or hours out of my week. I'm interjecting my therapy in my normal day. And they really like that.
And I imagine that taking that approach with sort of, it's the practicality of incorporating it into their everyday activities, that there's better compliance with the care plan. So you're getting ultimately better outcomes.
Yes.
At the end of the day.
Still kind of run into the, I forgot. But however, I will say I am specialized, unique, that the patients that reach out are like, I'm going to listen to everything that you say. But likewise, as you said, giving somebody 2 sheets with 12 exercises on, so 24 exercise, this mountain of stuff may just be like, whoa, that's way more than I want to do. But if I say, hey, I want you to do this one thing, X number of times during the day, it fits really into my day. And then we can find the spots where they can do it as well.
You were a college athlete.
Mm-hmm.
How has that experience informed how you help your patients?
So way back when, I just thought this was the most interesting thing. And then I'm like, why can I do this in college as an athlete, but I cannot do that with anybody outside of it? If I did track and field, I was a shot putter and hammer thrower. If I was hurt, if I was sick, if I was whatever, I walked right into the athletic trainer's office. He could assess me and say, this is just a sprained ankle. We can start working with you right now. No, you need to go see the doc. Let's get you an appointment. So he was this point that could do so many things for me. And I was like, why do we not have that outside of it? And so I try to base it upon that again, somebody can contact me. Hey, I'm having this weird pain. Is this normal? Okay, I can assess you and say, this is something that we can treat. We can go from there. If it's not, okay, here is a local, shoulder person or the knee person or a cardiologist or, and can give them that. So at least, I can be just somebody that can help direct as well with what they do. And I really saw that's just like a really good model to have on it. And I trusted the athletic trainer, and I want my patients to trust me in that way as well.
Was that did that serve as sort of your inspiration for going into therapy?
It did. I was injured in high school. I broke my leg, and I had a few aches and pains and stuff like that in college, and I had a wonderful athletic trainer I'll never forget. So I mentioned that I am McKenzie, diplomat at McKenzie, so I'm all the way at the top of the McKenzie ladder there. And I'll never forget one day I was in the training room. He told me, he's like, hey, I learned about this thing called the McKenzie approach. And he just gave me, looking back now, the worst explanation of it whatsoever. Like somebody who just taken one course in it. The worst thing in it. And I thought it was really cool. And he also was he wanted people to be very active in the recovery of it as well. So he didn't want you just to come in, oh, you pulled your hamstring, ice and stem. Okay, before practice, we'll do some heat, just stretch it, he was very, very active in it. You need to do this, you need to do these things. This load you up, going. And so that really shaped, kind of like, wow, this is really what I would like to do. So he kind of directed me into the world of physical therapy, and so here I am today. And I will tell this funny story about him as well. We went to the CSM conference. I think the statute of limitations is up on this. We went, it was in San Diego in like 2010. He snuck in, and we're walking around, and we go to the McKenzie booth, and he knew some of them, and he's just chatting with them. And he said, oh, well, scan your badge so you can, they have a thing for a free membership. I said, okay, scan my badge. Okay, whatever. A couple weeks later, I get a letter. Hey, you want a free membership? And so you got like a couple journals, you get 10% off the courses. And I was like, oh, okay, cool. And so I think I used that 10% to sign up for my first class. And then that led me down this road. And I tell everybody in the McKenzie, I was like, you got me because you gave me a free membership. Granted, they probably gave everybody a free membership. But I found the letter, and I keep the letter. Just cleaning out some stuff from school. I found the letter, and I said, yeah, I'm going to keep it. I said, y'all got me with a free membership. And I went all the way through it.
Well, there you go. That's, that really speaks to my marketing heart.
Yeah.
That little freebie there brings people in for sure. So for those that might not be familiar, what is the McKenzie Method? Just, real quick, high level.
So Robin McKenzie was a therapist from New Zealand, and very practical guy. He has a book called Against the Tides, which is kind of his life story. And he looked at therapy just a little bit different. He said, we had these things, like I saw people with like thoracic injuries, and I was like, we had to make them do breathing exercise, and realized, well, this really didn't work. And a patient came in one day with his bad back and leg pain, and he had him lay on the table, which the head of the table was up, and the guy said, my leg feels better. So he started exploring, what does this do? What if we start doing certain movements and things in certain directions? What does it do? And he developed this method, and it's been expanded upon. Lots of research out there. It's a huge debate over a lot of stuff on it. But really, you look at somebody and try to understand, do they have, we say, mechanical pain or not? And that's what I would tell everybody. First and foremost, what I want to understand, is your pain mechanical? Okay. If it is, we can treat it. If not, it may be something else. I may have to direct you to another provider or something else. But I say also, it lets me know, can I help you or not? Because if it is mechanical, I probably can help you. It also could be mechanical and you just don't like me and it won't help you. I was like, or we find like, hey, this is something we need to send you off to have surgery or maybe counseling or anything. So really, I said that's kind of the basis of it. It gives me an understanding of what to do with the patient. It's getting the patient, they're moving and they feel better, and it kind of really sets this guideline of how I treat it. And if you really read the book, his story, it gets way deeper than some of the books that other people have read, such as the Treat Your Own Back, Treat Your Own Neck, where he was very big into getting people moving. He called it play hardening. He's like, if you can go swing a golf club, hey, I don't have that fear of hurting my back if I could swing a golf club. So you could tell somebody, go play 3 holes of golf. Hey, I played 3 holes of golf. I could bend and twist and do all this stuff, and it didn't hurt. Perfect. Yeah, we're going to keep. So kind of the basis of what I do.
Excellent. So we also when we were prepping, we were talking a little bit about powerlifting, right? And you treat some powerlifters, and you had mentioned, sort of the dynamic there of working with powerlifters. Like some PTs may advise lifters, like if they're experiencing some pain, that the advice might be stop lifting such heavy weights, and you won't experience that pain anymore. But what's your take on that approach, and how would you do things differently if you were faced with a lifter coming in and saying, "Hey, I'm having some pain when I lift heavy"?
So, well, one thing I see with what we do in therapy, and really any medical provider, is really we should need to understand what the person does. And I've met so many therapists from my PT school class on who are not athletic whatsoever, and they don't understand a sport. So again, somebody like a powerlifter going to someone who doesn't even go to the gym, who may do another form of exercise or something, they don't understand what they do on it. So that's one thing. And then I always say, like, the term heavy is relative on it. Like, really, what is heavy? When anybody says, like, kids shouldn't lift heavy, I'm like, well, what's the cutoff? You shouldn't lift heavy weights. What's the cutoff? 50 pounds, that could be heavy if that's a bag of dog food, but if your car weighed 50 pounds, that's not very heavy. And, even somebody lifting weights, somebody who weighs 100 pounds, a 200-pound deadlift could be heavy to them compared to somebody who's 300 pounds. A 200-pound deadlift may not be heavy with them. Or that 100-pound lifter is an elite athlete, that 200 pounds is nothing to them. That 300-pound person just started lifting last week, and 200 pounds is extremely heavy to them. So it's understanding, like, what they are doing and building them back up. And a lot of it also comes down to educating the lifters and getting their buy-in too. That it's kind of like, hey, I'm one of you. I'm in the community. I live too. And I don't believe that lifting heavy is bad for you if you're managing your load and sleeping and you're eating and you're doing all those things right, that you can get back to lifting heavy. And we can get you back onto that and building you back. The same thing as you built your strength up, we're going to build you back with your rehab on it. And so I tell them, like, you don't have to stop lifting necessarily. If you had a surgery or, something is really inflamed, like, you may need to stop. But I was like, tell them most of the time, no, we're not going to have you, stop lifting. We want to build you back up to get you confident again to lift heavy where you're not going to have any pain anymore.
Right. It goes back to, what you had said in the beginning, walking with your patient, right? Understanding them and getting them back to where they want to be.
Yeah. That's always that group is a very fun group because you really can walk with them all the way back to like a big meet. And there's this little funny point that they get so, okay, there's two funny points. One, like the moment they feel better, like they dump all the rehab stuff and they're like, oh, I can go lift it again. It's like, no. Like, we are not there yet. So that's the thing. But also that bridge from, hey, it doesn't hurt to walk around or, pick up my kids or do it. It doesn't bother me when I do any of that. But I can't, as soon as I put this weight on my back or whatever this is, whatever the lift is, I start having discomfort again. And I was like, we just have to bridge you. What we were doing was working. We may have to push you a little harder. We may have to do things a little bit different, really work some stuff because you're working at a way higher level than an average person. But so we may have to do a couple little different things with you, but don't worry about it. We can get you over that. You're in a different class. We have to bridge from normal things being pain-free to your extreme, like your heavy workload is pain-free.
Absolutely. So tell me, Matt, so how has your approach of walking with your patients helped you grow your practice?
Really, it's people see that therapy doesn't have to be this giant burden or this giant time away from their life. Now, granted, if they are really hurting or, a surgery, they understand this is necessary. We really need to do it. But those people that, this is kind of bothering me. This is annoying. I tell them it's like, we're not going to take a lot out of your day. You're not going to have to drive 30 minutes to see me, spend an hour in here, drive 30 minutes home. That's 2 hours that you've just spent. We can interject something in your day, and that we're not going to give you a ton. I'm not going to give you 30 exercises to do, all this stuff to do. I'm not going to do that. I want just to, again, allow you to keep living your life. And we're just kind of giving you these guidelines, and we're talking about different things as we go along. And they say, oh, wow, like that's, I really, really like that. I see that I'm not, again, having to go 3 times a week, and that's 6 hours, if it's, 6 hours, 3 hours or whatever. It's not this huge chunk of time away from everything. I can talk to my therapist whenever. So I tell them all, I give them my phone number, say, text me. I'm going to text you in 2 days. If you have questions, we'll talk and we chat. And if they say, I don't think I'm doing this exercise right. Okay, let me shoot a video of you doing it. Oh, okay. Put your leg here. Oh, okay. I feel that. There you go. And I've even had them, on a weekend or something, oh, I did something. I think I tweaked my back, and we may just chat a little bit, and puts them back on that path on it. And they really like it. So as I say to them, like, you're not taking away from your normal life to do therapy. So it seems like more people with little nagging, annoying issues will reach out compared to like when it gets full blown and really bad.
So as we wrap up here, any final thoughts for other practitioners that are looking to grow their business? Any advice for them?
Really, I would say, find your niche, what you like, what you really know on that. There is the thing I see that people, they try to, as therapists, be like a generalist, like everything. Oh, I just got to like treat everything. I'll tell people what I don't know. If somebody says, hey, my mother had a stroke, can she see you? I said, I'm really not the best therapist to see for somebody who just had a stroke. That's not my strength. But if you have back pain or neck pain, I'm gladly take care of you. And as well, just having a relationship with your patients. And you can just start with your community, that you get known as the person to go to for this issue. And, the person that they go to for knee issues or this or that. And because that you just build this thing up, and you're willing to talk to people and willing to communicate. And I say a big thing to ask with people is just why, if somebody disagrees with you, well, why do you feel like that? Do you want to have a discussion on that? And then they start buying into you more and more and more, just because they feel like, oh, I could talk with this person is going to talk with me about what's going on.
Excellent. Well, Matt, we are out of time for today, but I wanted to thank you for joining us. We really appreciate you coming on and sharing your thoughts with us today. So thank you for joining us. And thank you to the audience for tuning in to the Therapy Matters podcast, your one-stop resource for expert insights and advice on everything therapy and rehab. We look forward to seeing you on the next episode. Thank you. Thanks for listening to Therapy Matters. Do you like the podcast? Give us a 5-star rating, subscribe, and tell all your friends about the show. Want to be a guest or know someone that would be a great guest speaker? Contact me at allison.jones@raintreeinc.com. That's allison.jones@raintreeinc.com. Therapy Matters is brought to you by Raintree, therapy and rehab's favorite EMR. Raintree is the only all-in-one therapy EMR delivering a complete and seamless end-to-end patient journey, from first contact to payment to patient retention. To learn more about Raintree, visit us online at raintreeinc.com.